Hello, my name is Dr. S. Rawat. I'm a UK trained physician based in Canada. I've written over 40 blogs, and today's blog is about lifestyle and dietary management of raised blood pressure. So first, we'll talk about the diagnosis of blood pressure. It's a very common diagnosis and has strong association with cardiovascular diseases such as heart attacks, strokes, peripheral vascular disease, erectile dysfunction, etc. It's one of the leading risk factors for premature death in the world. And there is more detail on my blog about this. Even a 2 millimeter rise in blood pressure of mercury is associated with a 7% increased risk of mortality from ischemic heart disease and 10% mortality from a stroke. And so here I have the JNC7 classification for a normal blood pressure, pre-hypertension, stage 1 hypertension, stage 2 hypertension. The most common cause of hypertension is what we describe as primary or essential hypertension, in which there is no obvious cause. As we get older, there are genetic factors, factors related to hardening of blood vessels, the kidneys excreting less salt as we get older, which naturally lead to increased blood pressure. In a small minority of cases, there could be a secondary cause of hypertension, and particularly in young patients. I'd say certainly if you're under the age of 40, it may be worthwhile to get tested to rule out rare secondary causes of high blood pressure. These could be related to hormonal causes such as hormones secreted by the adrenal glands, etc. Here on the blog, I also discuss how to measure your blood pressure. And increasingly, it's quite important now to not just measure the blood pressure in a clinic, but also measure it at home using, of course, a validated machine. Here I have a list of validated machines. Generally speaking, if you go with the Omron, which is a Japanese company, you can't go wrong. They're all gold certified. And I have put some links here as well for you. Here I've put some instructions on how to adequately measure your blood pressure. Of course, you need to be relaxed. Your arm needs to be resting at round about just below your heart level. Take 3 readings, note down the lowest one, alternate your arms. All the instructions are on the blog. Here I talk about UK guidance as well as American Heart Association guidance for target for blood pressure. You will note that depending upon country and also depending upon age, the targets can be slightly different. Generally speaking, if you're targeting below 130/80, that's quite reasonable. A low blood pressure, I would say, is if the top number is below 110 and the bottom number is below 50, particularly if it's associated with symptoms such as lightheadedness, faint feeling. Some people, particularly young females, have a baseline low blood pressure, and as long as it's not associated with any symptoms, that's not a problem. Here now we talk about lifestyle and dietary modifications to reduce blood pressure. Weight reduction, particularly waist circumference reduction, is very important to reduce blood pressure. Limiting alcohol intake, reducing sodium or salt intake, maintaining adequate potassium intake, along with also magnesium and calcium is useful. Stopping smoking, reducing saturated fats in the diet, engaging in exercise are all important. A particular diet called DASH diet was developed primarily to reduce hypertension, and it's similar to other types of diets like Mediterranean diet, paleo type diet, in which the emphasis is on fresh fruits, vegetables, organic foods, whole fibers, fish, etc. I've also talked about other diets in my other blogs. Obstructive sleep apnea is typically when a patient is obese, has a large neck, snores at night, and stops breathing during their sleep. It's a very common but underdiagnosed secondary cause of hypertension. And it's very important to get a sleep check done and manage this condition if that is suspected. I've also detailed some features of treatments and medication on my blog, and I would encourage you to go and check that out.